I'm so glad you came back to see my part 2 of cancer series. As I said before, unfortunately there's no cure for cancer, but there are multiple things that we can do to improve the quality of life for our pets when they are diagnosed while they are still here with us. Often my clients are coming to me looking for some type of hope. And in this video, I want to give that to you. I'm going to give you an overview of 7 more alternative therapies that can improve the quality of life of your pets while they're still here with us. I'm Dr. Sally, and I've been practicing for about 20 years. In the past 10 years, I've been focused on holistic medicine. And because of that, over half of my patients come to me with a diagnosis of cancer. Last time I discussed the 4 branches of TCVM, which is acupuncture, Chinese food therapy, Chinese herbal therapy, and Tui Na, which is canine massage or medical manipulation. And I put a link to that video in the description. The awesome thing about dogs and cats is that they live in the present moment. So they actually aren't worried about their diagnosis, and they are just living their life to the fullest. So that should be one of our goals as pet parents, is to learn from them on that and support them through this time. Often one of my goals when I first meet a client who has brought me a pet that has been diagnosed with cancer is to discuss the changing of energy. If we as owners focus on the negativity and the sadness about the diagnosis, our pets pick up on that. And so one of the things that I recommend is just trying to enjoy the time that we have and focus on love, because they bring us so much love. So that's what we should give them back in return. My professor at the Chi University gives a really good analogy. He says, if you live in a cul-de-sac where all the neighbors are great except for one, you can't just all move away from the cul-de-sac. So basically what everybody does is sort of ignores that neighbor and lives in harmony around or without that neighbor. And so that's a good analogy of thinking about the cancer. So you just sort of ignore the cancer and look for harmony of the rest of the body. And so that's the goal of the treatment with all of these alternative therapies. I do truly understand that this is hard to do. I lost my own heart dog, Linus, who was a Harlequin Great Dane, at the age of 6 to lymphoma. But if we can learn to enjoy our time that we have with them, we will definitely have no regrets once they are gone. And as a reminder, I'm not saying that you should do all of these types of therapies. I'm just trying to get the awareness out, because I have so many clients who tell me, I had no idea any of these were options. So I'm just going to briefly discuss 7 alternative therapies that are available. These aren't in any particular order. The first point that I want to talk about isn't a therapy, but it is a recommendation. Absolutely no more vaccines. Vaccines stimulate the immune system, and in cancer patients, their immune system is already lower than normal. So regardless of whether they go to boarding or grooming or a daycare, please ask your veterinarian for a vaccine exemption letter if they still have requirements for vaccines. But there really should be no reason to give any cancer patient a vaccine at all. And for more information on vaccines in general, I've also attached the links below to previous videos that I made on vaccines in cats and dogs. The second thing I'm going to mention is also not really a therapy, but a strong recommendation to start using natural heartworm, flea, and tick preventions if they are on the standard pesticides. Anything we can do to decrease the amount of toxins we're putting into their body can help their body to stay healthier while they're fighting cancer. This is something that you need to discuss with your veterinarian and weigh out the risks versus benefits. But in my area, heartworms are pretty low, and so natural heartworm preventions are an acceptable option. One of my favorites for flea, tick, and heartworm prevention is an essential oil product called Wondercide. There's a top spot that's once a month, topical sort of like Frontline, or there's a collar that lasts for 3 months. There's also a spray, but that is needed to be applied daily, and most people fail on that. They also have a really nice yard spray that I recommend people using in their yard rather than the typical yard sprays. Another option that I love is called Fleas Gone, and you can check this out at fleasgone.com. It's a pendant that makes an electromagnetic wave with the heart that repels fleas, ticks, and mosquitoes. I've personally used this on my dogs for years, and on hundreds of clients with no failures. The third thing that I'm going to discuss is essential oils. This is not one of my fortes, but I have a lot of clients who like to use them, and so I support them in that. I mainly refer to this book written by a veterinarian all about essential oils. There is a lot of controversy on essential oils, so I recommend using these at your own risk, but in general, they are very safe. I definitely don't recommend pets ingesting essential oils. Especially applying topically to cats can be dangerous as they clean themselves so frequently. When you're diffusing oils, I highly recommend that you leave the door open so that if a pet wants to leave the room because it's too strong or they don't like it, they have that option. In my opinion, essential oils are sort of an adjunctive therapy to most of the other therapies that I recommend. But if an owner really wants to use them, I highly support them. I have had a lot of success of using frankincense applied neatly on warts to get rid of warts. The fourth alternative option that I'm going to discuss in this video is supplements. I can't say that I'm a huge supplement person, and mostly that is because there's just so many supplements on the market, and most of the information is anecdotal. And I've had so many clients come to me with bags full of supplements because they're just sort of in a desperate way trying to find anything that will help their dog or cat. In my opinion, there are just so many options that it's hard to keep them all straight. So I recommend finding 1 or 2 supplements that you resonate with and stick with that. Also, if you know someone who does muscle testing or applied kinesiology, you can also ask them to test those supplements for your pet to see if they are strong or weak. There are a handful of supplements that I use routinely in patients with cancer. One of my favorites is mushroom supplements. Either a combo product that has multiple types of mushrooms in it, or turkey tail, which is specifically made for cancer patients. My favorite brand is Real Mushroom brand, and it really does matter how the mushrooms are processed, so I trust the Real Mushroom brand. I use a lot of CBD in my cancer patients as well. You can discuss this with your veterinarian if it is legal in your state. Another common supplement that I use is omega-3 fatty acids, which is really good for their brain and gut. And in conjunction with that, I really like to have probiotics on board to support the gut because our immune system starts in the gut. And the last supplement that I use very commonly is Myos Vet. This is a supplement for muscle degradation. It helps to block the muscle degradation, and usually my cancer patients will have some muscle atrophy because they are also geriatric. This product is fortified egg protein with fortitropin in it. So the patients often love it because it's literally ground up egg yolk. Make sure that you get the vet formula because there is a product out there that is non-vet formula, but it does not have the fortitropin in it, which is the actual active ingredient that makes the product effective. So again, for supplements, I would just pick 1 or 2 that really resonate with you and try not to go overboard. Because if something worked every time, everyone would be doing it. Homeopathy is the 5th thing that I will discuss. I think homeopathy is great, and I support my clients who are interested in it. I do not practice homeopathy. However, in my food therapy, I do use a homeopathic philosophy. Say, for instance, your pet has liver cancer, then I would feed liver to that pet. Or if they have kidney cancer or kidney disease, I would feed them kidney or even kidney beans. The 6th alternative therapy that I'll mention here is crystal therapy. Crystals can help the body harmonize using energy. Watch for a video in the future about crystal therapy. But if you're into this, you can research which crystals support which organs of whichever type of cancer your pet has. Or you can take any crystals that you have and set healing and love intention into those crystals, and then either put them in their water bowl or in their bed so that they can absorb that energy. I'm also working on a product called the Lotus Pouch, where it's a little pouch that can be hooked to your pet's collar or harness for an easy way for them to carry around the crystals. I'm so excited about that product, so keep an eye out for that. And last but definitely not least, lucky number 7 is ozone therapy. Have you guys heard of this? In humans, this therapy is FDA approved for dental abscesses. Ozone is O3 gas, which stimulates the immune system to promote healing on a mitochondrial level. It has anti-inflammatory, antiviral, antibacterial, antifungal, and anti-cancer properties. It can be given rectally in gas form or in a solution such as saline, like for sub-Q fluids. Or we can draw your pet's blood and wash it with ozone and give it back to your pet either through an intramuscular injection or IV infusion. At my practice, I typically use rectal gas, and the patients handle it pretty well. The ozone is absorbed through the colonic veins and then spread throughout the body. I also plan to make a video about this, but if you want more information on this now, I would check out o3pets.com. They are a really good company and have a lot of information available. I truly hope this video has given you some hope. There are lots of therapies out there, and I would love to discuss these with you. If you're interested in an online consult, you can find me on Direct Health for Patients, and then you enter the code B as in boy, ARCLEA 475.